Hi, everyone, and welcome to Annie Henderson's webinar on mental health in rural communities and schools. You can turn off your camera, but please, you can turn on your camera if you feel comfortable, but please mute during this presentation and stick around till the end for a Q&A after. Annie is a first-year school psychology EDS student at the University of Utah. She is originally from Iowa and previously attended the University of Iowa studying psychology and dance. She currently works as a graduate assistant in the Ascend program through the UTTEC lab. So I'll turn the time over to Annie, and there's a flyer about her in the chat.
Thanks, Molly. Okay. Okay, can everyone see my screen? Okay, perfect. All right, so as Molly said, my name is Annie Henderson, and today I'm presenting on mental health in rural communities and schools, and this is part of the UTTEC Lab webinar series. So just to start off with a little bit about myself, I'm originally from a super small town in Iowa. I graduated with about 19 people in my class. And I went to the University of Iowa in Iowa City, and I got my bachelor's degree in psychology and a minor in dance. I'm now a first-year student studying school psychology at the University of Utah. And I'm also a first-generation college student. And I'm currently working in the Ascend program with the UTTEC lab. And then just some of my interests are yoga, skiing, going on walks, and hanging out with my friends. I wanted to add in just a disclosure on why I wanted to present on this topic. So like I said, I grew up in Iowa in a really small town. My town was called UTTEC, Iowa. This is a photo of our main street. So the current population is just under 300 people. So my school was extremely small. I graduated with like 19 people in my class, and 2 years later, my school actually shut down because of funding issues. The high school did. So with that said, there's a lot that I would love to talk about regarding lack of resources in rural areas. And this area of mental health needs in rural areas is really close to my heart because I grew up having lived and experienced some of these things. I do want to acknowledge my privilege for being able to make it this far in my educational career to be presenting on this topic. And it feels really special to be able to talk about this. So thank you all for being here. And for those who are viewing this at a later time, thank you for watching my webinar. Okay, so some of the topic areas that I'm going to cover. First, what defines rural? I think we might have different ideas of what this looks like. So I think it's important to kind of define how I'm going to talk about it today. How does rural living impact individuals and students with mental health needs? So I'll kind of talk about rural populations as a whole and then break that down into students in these schools specifically. And then what does this mean for school psychologists? So even though many of us may not be personally or currently working with this population of students, why is this topic still important for us to talk about? And then what can be done to help? Okay, so what is rural anyways? So like I said, I think we all might have different ideas of what this looks like in our heads. So if anyone's able to, if you could share just what initially comes to mind when you think of a rural population, feel free to unmute or drop something in the chat if you're comfortable.
I think of being in a country setting, being sort of surrounded by nature and just, not a lot of people population-wise, and not a lot of resources. That's what comes to mind for me.
Yeah, thanks, Alicia. And Lauren says lots of land and not a lot of people. Totally. Oops, sorry. I lost my screen sharing. Okay, so so to kind of help further define what rural is. I'm going to talk about like what rural isn't. So the US Census Bureau defines an area to be urban if that area has more than 50,000 people there. An urban cluster is defined as being less than 50,000 people, but more than 2,500 people. And then whatever is left over is considered to be rural. So not a lot of people. And I invite you to kind of think about what that means in terms of resources and what a community that small might have in terms of resources. Okay, so I was surprised by this number just because when you think of a place that is less than 2,500 people, it seems like that wouldn't make up so much of the country. But yeah, 30% of all school districts are in a rural area, and this serves about 1/5 of all public school students. So as you can imagine, residing in an area with less than 2,500 people in it can make it kind of hard to attract high quality school professionals. Okay. So how does rural living impact individuals with mental health needs? So just to highlight some of the factors that go into this, we have some protective factors, and these are things that kind of help individuals from developing negative mental health symptoms or worsening mental health symptoms. And we have risk factors. These are things that make it a little more likely for individuals to develop negative mental health symptoms. And then environmental factors, so things in the individual's environment that may affect if they do or do not develop negative mental health symptoms. And I wanted to highlight a few of these that might be most specific to rural areas. So family and community support underneath protective factors. Rural communities are known to kind of have a really close-knit environment to them, and this can be really supportive and beneficial for individuals. But then under risk factors, we see social isolation. So they can be pretty isolated from the outside world and can be really far distances from urban areas. And it's like who you grow up with is who you're around. And sometimes that can be negative for individuals who might not get the exposure to other things like they might want. And then underneath environmental factors, we have community attitudes or stigma. So because of the close-knit characteristics of rural communities, individuals are more likely to experience embarrassment around mental health issues, and they may also experience less acceptance around seeking mental health support as well. Okay, so looking at how this compares to the general population, compared to the general population, rural communities have been found to have lower median household income, levels of employment, educational attainment, and then higher rates of death by suicide and higher rates of poverty. These are all risk factors for developing worsening mental health symptoms as well. Okay, so I apologize for the kind of blurry photo, but this is a graph that represents suicide rates by level of county urbanization from 1999 to 2015. The data used in this is per 100,000 residents and 10 years old or older. So if you look, that top blue dashed line represents non-metro areas. And if we look at like the dark blue solid line, that's the United States sample. So it's a pretty substantial difference here. And I think it's kind of interesting to look at the trend, how it goes from like non-metro areas to micropolitan, to small metro, medium metro, and so forth. I think that it's just really interesting to look at that. And then this graph, so the CDC also notes that like you see there's like an upward trend that can be kind of attributed to like the opioid epidemic and an economic recession. So we're not so much looking at the rise in rates, but more so just the differences between non-metro areas and metro areas. Okay, and according to a 2020 report from the CDC, from 2000 to 2018, the rural suicide rate increased by 48%, while urban rates increased by 34%. And then in 2018, the suicide rate in rural counties was 19.4 deaths per 100,000 people, compared with urban counties at 13.4 deaths per 100,000 people. So just some interesting differences to look at here. Okay, and when we talk about barriers, I want to break things down to look at 3 categories. So first, availability. This is really looking at shortages in mental health infrastructure. And then accessibility, things like increased transportation distances, insurance limitations, financial barriers, and then lack of knowledge of services and symptoms. And then acceptability, and that looks like a higher degree of stigma in these communities. So in terms of availability, this is a map of mental health professional shortage areas in the United States. So the gray areas are non-professional shortage areas. And then the light blue areas are areas that have high levels of shortages. So it's kind of interesting how you can kind of see there's like a trend going on a little bit, like more areas of light blue towards like the Midwest and the South, especially Texas, I think is really concerning. Yeah, I think that, and then like over on like the East Coast, not many health professional shortage areas, where there's like more metro areas there, and then same with the West Coast. So as of September 2021, there were 3,426 mental health professional shortage areas in rural areas identified. And it's estimated that it would take almost 1,600 practitioners to remove these designations. Okay, so moving on to accessibility. When we talk about accessibility, we can look at how being uninsured is a huge barrier to accessing services. So this map is just looking at non-metro areas. So anything that is white is considered a metro area. Darker green is a higher percentage of uninsured populations, and lighter green is a lower percentage. So we kind of see the same trend as the last map we looked at, kind of more dense in like the Midwest states, the West states, the South, especially Texas is again pretty concerning. It's like one of the only states that has those dark green areas. And lack of insurance is a huge barrier to accessing services with a provider in the community. Okay, and then acceptability. So because these rural communities have lower population densities, they tend to have higher density social networks, and that can lead to higher degree of stigma and more hesitancy to seek out services. And then because of lack of resources, it's not uncommon for individuals to seek care with a local family care physician rather than someone specialized in psychology or psychiatry. And I found this really interesting and concerning, that researchers have actually found that primary care physicians in rural areas will sometimes underdiagnose mental health disorders because of stigma and doubts about the patient's acceptability of the diagnosis. So a lot going on there. Okay, so what about the children? We're going to kind of switch gears to talk about students in schools specifically. So we know that there's a lot of barriers about how it's really hard for individuals to access services in their community, especially in these rural communities. So things like we talked about transportation issues, availability of services, insurance limitations, financial cost, stigma, and so forth. So our potential solution is school-based services. So providing these services in schools where kids are at anyways, and they spend the majority of their days there. And our big goal here is to essentially provide services to those who need it and who would otherwise not be able to access services in their community. And for those who potentially could access services, hopefully make it easier on them. It's approximated that about 1/5 of youths have mental health disorder, yet only 30% actually receive services, which I think is pretty concerning. Okay, so although rural environments are pretty similar to urban ones in terms of like prevalence of mental health concerns in children, rural populations have really unique demographic and psychosocial characteristics, which might make their needs different than those of urban individuals and students. So it's really important to like focus on these groups separately, I think. Okay, so a lot of studies have found that school-based services are effective in improving self-esteem, self-efficacy, reduction in psychiatric symptoms, reduction in problem behaviors, promising results on early intervention services for students high risk for suicide, and overall improvement of mental health and pro-social behaviors. They've also found academic benefits, increased life skills, such as stress management and anger management, improved attendance, and improved classroom compliance. So there's a ton of benefits that have been identified by using school-based mental health services. Okay, so we know that school-based services work. However, access to these services is still lacking. So we're going to talk about a lot of barriers. So like work demands for school professionals, access to training, lack of funding, limited amount of school-based mental health professionals. These have all been identified as significant challenges for schools providing services. Yeah, so we can look at like budget constraints and lack of funding, which is a really big barrier for schools providing services, access to trained mental health professionals, parent involvement, work demands for school professionals, and staff retention. And inadequate funding is actually one of the most cited barriers to rural schools providing mental health services. And then access to trained professionals is the next most cited one. Okay, so this was a study that was done looking at how students are able to access mental health professionals, and it breaks it down by comparing it to those in a city, those in a suburban area, and those in a rural area. So just accessing a diagnostic assessment. So at school by school employed mental health professionals, only 38% of students in rural districts were found to be able to have that access compared to 62% and 61% in suburban and cities, which is a pretty significant difference, I think. The differences between like at school by a school funded mental health professional, so like the school hiring someone to come in, but like someone who isn't necessarily on staff, that wasn't as significant. And then same with like outside of school by a school funded mental health professional, not as significant of a difference. But then when we look at treatment, we have at school by school employed professional, rural students, only 23% could access treatment there compared to like suburban at 46, which is double that. And then even outside of school or at school by a school funded professional, we still have 33%, which is quite a bit lower than the other two samples. And then outside of school by a school funded professional, that one isn't as significant again. Okay, so then it looked at why these schools couldn't provide these services. And the top two are the biggest ones. So inadequate access to professionals. Rural districts, 34% reported that that was a big limitation there. And then inadequate funding, 50% of districts in rural communities reported that that was their biggest limitation, which I think is huge. And then the last one that has a little asterisk by it is payment policies. And that one I didn't look into as much, but I think it's important that we really focus on inadequate funding and inadequate access to professionals. Okay, I also want to highlight that these issues might look different for underrepresented groups in rural schools. So youth that identify as lesbian, gay, bisexual, transgender, and queer, they have reported greater experiences of xenophobic bullying and hostility in rural schools compared to those in urban schools. So this suggests a really big need to provide school-based mental health services in prevention and early intervention to support those students who are vulnerable to negative treatment by peers. And I really wanted to highlight that these issues should be addressed at a tier 1 level. So I think that sometimes in rural settings, you may not be exposed to diversity as much as in urban settings. You might not learn about it as much. You might not understand others. And we know that a lot of judgment and like phobic feelings can come from a lack of understanding. So I think it's important to address these issues at a tier 1 level to all students so that they can understand the importance of diversity, equity, and inclusion. Okay, so where are all the school psychologists? Why are these schools having trouble accessing these professionals? So why don't school psychologists typically want to work in rural schools? So there has been not much research dedicated to this issue. And a lot of the research that was done was published in the 80s, so not very current data. So we really need more current literature to truly understand this issue. Okay, however, the research that was done earlier found that school psychologists face a lot of issues in rural districts, such as lack of other resources in the community, professional isolation, burnout, and limited access to quality continuing education. Therefore, they found that turnover rates were found to be much higher for school psychologists working in rural schools in comparison to those working in urban schools, which isn't really surprising given those issues. Okay, so one issue that I wanted to talk about is interconnectivity. So the interconnectivity among members of rural communities can be really beneficial for relationships, but it can kind of blur roles in terms of like professionalism. So like teachers might also be the parents of children in the school. I remember like when I was growing up, I had so many teachers who were also like the parents of my friends. It's not uncommon at all. School psychologists might work with children of their close friends. They may have their own children attending the school. So all of these characteristics can impact issues around dual relationships and confidentiality. Okay, and looking at competence. So school psychologists working in rural areas, they might be their clients' only access to services. So because of this, they might be relied on to provide care outside of their level of competence. And this can affect their caseload as well. So they have been found to have higher caseloads because of this. And this can kind of increase the likelihood of encountering something that's out of their competence level. So some recommendations for school psychologists who are working in rural areas. We can look at collaboration of service members working in rural areas. The importance of consultation, I think, is really huge, especially when facing things that you're not really sure if are out of your competence level or not. And this can be done via teleconferencing because we know that distances to areas with maybe more professionals in them might be kind of long. So can use teleconferencing a lot. And then joining and participating in professional organizations such as NASP and your state school psychological association, and then global school psychology networks. And then setting clear boundaries to avoid dual relationship issues is really huge as well. Okay, so even when rural schools do have the funding to hire on school-based professionals, they face the barrier of attracting those professionals to apply. And I thought that this next part is really interesting. So rural schools are actually less likely to require for school counselors, social workers, school psychologists to be licensed, certified, or credentialed by state agencies or licensing boards than urban schools. Okay, so this video that I'm going to show, it focuses on the lack of teachers in rural America, but I think it really puts into perspective how scarce resources really are in these areas and why it's hard to attract professionals to these areas. So we're just going to watch this. Can everyone still see it? Just a thumbs up. Okay, awesome.
Of course, the day you start something like this, the lights aren't going to come all the way on. Mood lighting.
Elliot Crump is the school superintendent in Shelby, Montana, one of the countless small rural towns that's run out of teachers.
Yeah, you guys have 20 minutes. The kids that come out of Bozeman and Missoula and our education schools here in Montana, they tend to focus on those larger cities. It's going to be nice to get them out here, see what it's like, and hopefully get them to join the rural teaching community.
250 miles away in Bozeman, 13 aspiring teachers from Montana State University headed out for Shelby.
What a good morning, gosh. Shelby, Montana. I don't know too much about it. I looked it up on Google Maps. That's the only research I did. Zoomed in and it looked pretty brown, but it's okay. I'm excited anyway. I'm not there for the landscape, I'm there for the people.
I love small towns. I came from a small town and I've always wanted to teach in a small school. So yeah, I'm super stoked.
You are approaching your destination.
Ooh, we are approaching.
Good morning. Good morning. Good morning. So I'll go first. My name is Elliot Crump. I'm the superintendent here. I used to teach social studies. I'm originally from the Seattle area.
I'm Jake Lyle. I'm originally from Plains, Montana, graduated there in 2016. I'm studying English teaching, want to be an English teacher.
Good morning. My name is Ned Bardsley. When I grow up, I want to be an art teacher.
I would love the practicum students to go through this program, enjoy being here in Shelby. And when I have an opening next year, the year after that, they're thinking, gosh, it would be really nice to be able to go back to Shelby and be a part of that community and that school. I don't know if it's going to work, but I hope it does.
Shelby, Montana spans 6 square miles and is home to about 700 families, 1 K-12 school, and 1 main street that runs only a few blocks. It's an hour and a half from the nearest Walmart, 3 hours from the nearest Costco, and 4 hours from the nearest major airport.
There are some districts in Montana that don't get an applicant for a job. You know, even 10 years ago, they were still pulling in people, getting applications, being more selective about who we can hire. Now it's just find someone.
Dr. Tina Versland researches rural education. For the last 3 years, she's helped run the program that sends future teachers on a week-long date with the towns that need them the most.
If you're a school and you can't fill teacher positions, what ends up happening to like your offerings? What ends up happening to your school, your students?
Can't find teachers. Young parents start to pull their kids out of school. They start sending them to neighboring schools. Maybe they leave that area. So schools can't find teachers. Schools die. Community dies.
Shelby isn't dead, but in small towns throughout Montana, This is already an emergency. Nearly half of all schools in the state now employ teachers who aren't certified, and almost all of those schools are in rural communities.
What was your temperature?
400.
It's cooked.
So we met in New York, started dating in New York.
I was a city girl. I never thought I would be like in Montana. When I told my parents I was moving to Montana, they're like, where is that? You moving to the mountains? Moving to the mountains?
The state.
So you've been here for 5 years. You've seen people come and go.
Yep.
Yeah.
You know, when we first got here, we hired 10 teachers and I lost 8 of them within a year or two. I haven't heard of things that I haven't tried. If I heard about it, I would have tried it.
And that's 36.
One of the things Elliot has pioneered, looking for teachers outside of the country, in places where $35,000 a year is a small fortune. 4 years ago, he hired his first teacher from the Philippines. He's since hired 4 more.
Shelby is like, oh my God, this is really a small town. I didn't even see people walking on the streets and said, oh my gosh, this is kind of, it's like a ghost town or something.
I imagine you weren't like, I'm going to go teach in Shelby, Montana.
No, it's the Shelby who chose me. Even though we don't have that much of shopping malls and all the stuff, but we like the simplicity of Shelby. I could send money to my family back in the Philippines, and I could also save money. So it's really, really helpful.
So bringing the Filipino teachers here has worked. Right? They've come, they've wanted to stay. How it works in the long run, I'm not sure. Their end of their visa is going to be after 3 years, then they can get a 2-year extension. After that, they'll be heading back to the Philippines.
It doesn't sound like a long-term solution to the problem.
It doesn't sound like a long-term solution.
That's why Elliot and the whole town rolled out the red carpet for the MSU students.
Equal lab. There we go. X. Nice job. All right. Equal lateral triangle.
Welcome to your favorite class.
Yeah, sure. All right. First off, how y'all doing with that? Good. Talk to you guys. Okay, so you're gonna try to capture that briefly as well.
When they weren't in classrooms teaching, they were given the star treatment. They took Shelby's fire trucks out for a joyride. They shot guns. And they went bowling. The 20-somethings are 20-somethings. They want to know what happens after 8 p.m. on a school night.
Let's see what the first one we get. Oh, come on.
KC, 22.
How do you up your age? I think I'm gonna need to do that.
Oh yeah, definitely.
How do you do it?
I got two.
You don't have a lot of options.
I don't have many options here. It's in 76 miles. I moved it up to 50 and then.
But you could be like a really big fish in a small pond.
It's true. Maybe.
Hello. I'm Rochelle. Josh, nice to meet you.
So for someone in their 20s, like what are the sort of things that you end up doing?
Well, other than going out on a county road and just shooting gophers or shooting basically anything. I mean, as far as the community goes, we have pool league, dart league, bowling league. That's when you're bored. You're bored.
Oh, bro.
Who here would move to this area if they were offered a job today?
I'd have to talk to my fiance. I'm like, I can't like totally put up my hands.
Jake, you're super down to move here. Like, you would move here now, but your immediate response was, if I can convince my fiance.
It'd be a hard sell probably for my fiance. She's an interior designer, and there's probably not many interior design jobs around Shelby.
I think the issue is a social life. So like the school's great, but what are you gonna do outside of school?
Bowling league. Small towns are probably not for everybody, but you owe it to yourself to give it a chance to do more than drive through it and experience it for yourself.
I don't know how long I could stay. And I think that's the problem with it. I don't know how I can help that.
Okay. Okay, so what now? What can we do as researchers and practitioners to help with this issue? So some steps we can take, just to break it down, we can work on increasing awareness and research dedicated to this area. We can look at using telehealth and teleconsultation services, and we can advocate for a school district and school board involvement in funding. So talking about awareness and research, the mental health needs of youth that reside in rural areas, they're really understudied, and we need to work to understand their needs as we do those in urban areas. And I think that it's important to research things like funding issues, district leaders' knowledge and opinions on mental health in schools to see what we could do to like advocate for them to implement these services more. And then I'm looking at telehealth for rural schools specifically and how that can be used. Teleconsultation. So teleconsultation can help remove some of the really practical barriers that rural schools face, such as like distance and travel time. And school psychologists can consult with school professionals in rural areas to kind of remove this barrier of consultation. Okay, and then telemental health. So since the emergence of the COVID-19 pandemic, we all know that like many schools and health systems had to adapt to doing things virtually. So fortunately, this really sparked a lot of research and talks done about these things. Even like path beyond the scope of the pandemic. So we can look at using things like technology, like telepresence, robots and stuff, which I think is really interesting. And our lab has a lot of great information and has used those things. And then there's also a lot of stuff out there on like how to increase effectiveness of doing things via telehealth. So a lot of great research that can be done and that we can help apply to rural schools. And then I just kind of wanted to give a plug for this webinar. So Dr. Erin Fisher has this really great webinar on telemental health to engage online learners during the pandemic and beyond. And it has a lot of great strategies on how to keep students engaged while using these services and like how we can use them to the best of our abilities. So it can be found on the lab's website if you are interested and get a chance to check it out. Okay, and then advocating for involvement and funding. So there are like models out there that address the mental health needs in rural schools, but whether or not things actually happen kind of relies on the decision-making power of school district leaders. And then talking about funding, we can look at things like grants that pay for school psychologists to work in rural schools or other mental health providers to work in rural schools. And I think that our lab does some things with that. I'm not super knowledgeable on that, but definitely something to look into there. Okay, so mental health is public health, and I think that a lot of us know this at this point. There's a clear discrepancy between the mental health needs of school-aged youths and the resources available to address them. So this is a public health issue. And I really liked this quote from O'Malley. It says, education agencies must efficiently allocate their limited resources by adopting innovative public health models. The need for these effective approaches is acute in rural regions where resources tend to be scarce. Okay, so questions, comments? not, I can stop my share.
I have a question, Annie.
Oh yeah, go for it.
I like that you brought up like the element of, like marginalized kids having a harder time in rural communities. And I'm wondering like your thoughts on with that video, they were talking about bringing people in from other countries to these rural communities to try have them be teachers. And I wonder like how you think having diverse teachers come in impacts the students / like, how do you think that impacts the people who are coming into these really like small white rural communities?
I think that it's good for the students to, experience some more diversity because they might not get that just in their everyday life, and in their communities. But I do think it could be really hard for those professionals that are coming from outside countries to show up in this community that, might be one demographic and they might be another. So I think that can be really difficult. I think it's a really interesting idea, but yeah, I'm sure there's a ton of other issues that surround it. And I was thinking, I could probably do an entire webinar just on those issues, underrepresented groups in rural communities itself. So yeah, thank you. Okay, and then these are my resources, so.
Thank you, Annie. If there's any other last minute questions, you can either speak up or put them in the chat. Otherwise, reach out to Annie for more information on her resources or her presentation, and thank you so much.